Are you thinking about starting psychotherapy but are lost in how to find a psychotherapist? Hi, welcome to my channel on mental and physical health. My name is Gabriel Patridge. I'm a counselor in psychology and a physician, and in this video, I will give you some guidance on how to choose a psychotherapist that best fits your needs. Number one, I'm going to start with clarifying the different types of mental health professionals, which for some people can be confusing. Psychiatrist. A psychiatrist is a medical doctor that have been through medical school as do general practitioners, but with a specialization in mental illness and pharmacology and will have MD after their names. Like every physician, they were trained to assess, diagnose, and provide a treatment, in their case with medication. They treat mental disorders with medication and in general with limited conversation. They are reserved for more severe mental disorders like schizophrenia, psychotic symptoms such as delusions, hallucinations, bipolar disorder 1 and 2, or advanced dementia, just to name a few. If you see a psychiatrist, most likely you will leave with a diagnosis, if that is what you're looking for. There are a few psychiatrists who have gone beyond their medical training and specialization in psychiatry and have trained in a psychotherapeutical theory, which I will describe later in this video. In Canada, psychiatrists are the only mental health professionals covered by the provincial health insurance. If you ask your doctor to recommend a psychotherapist, just make sure that if they recommend a psychiatrist, that it's someone who offers a talking cure, unless all you want is medication. Psychologists. Psychologists usually have experience in research on a specific topic. They spend more time in academia focusing on areas of interest to them. Some psychologists have master's degrees while others have doctorate degrees, but not medical degrees. Those psychologists with doctorate degrees carry the title doctor. They might have the designation PSYD, doctorate in psychology, EDD, doctorate in education, indicating that their psychology doctoral program was part of a university or college of education, or PhD, Doctor of Philosophy. Now, regarding their services to you, there is no practical difference between the doctoral designations. However, you might not see a PhD in practice as they are generally more focused in research. Psychologists do not have the ability to prescribe any medication. Some might focus on diagnosing using the Diagnostic Statistical Manual or DSM. Finding a diagnosis can be a relief for some, while others may feel labeled, and many others may use the diagnosis as a justification to only take medication or as a crutch and not go through the process of psychotherapeutic treatment. So keep in mind that a diagnosis can be a double-edged sword. Masters in Counseling Psychology or counselors. In the United States, each state will have several different titles to identify professional counselors, as they may be called over there. Licensed Professional Counselor, LPC, Licensed Mental Health Counselor, LMHC, Licensed Clinical Professional Counselor, lcpc, just to name a few. For those living in the States, I have linked a complete list of those titles in the description below. Same with Canada. Several different titles are used to identify professional counselors in each province. In Ontario, commonly it is Registered Psychotherapist, RP, or Canadian Certified Counselors, CCC. In British Columbia, the province where I'm located, we are denominated Registered Clinical Counselors, RCC. I will use the example of British Columbia, but I'm sure that it's similar in all of Canada and the US. Registered clinical counselors are highly qualified counselors who belong to the BC Association of Clinical Counselors, BCACC, and meet stringent graduate level education and training standards. This is a counseling designation common to BC. The minimum education requirement is a master's degree in counseling psychology or similar. The practitioner should meet other required clinical standards as well. This is considered the gold standard for master's level psychotherapists and counselors, same as Canadian Certified Counselor. Now, The issue is that counseling is a misleading nomination because it means the job or process of listening to someone and giving that person advice about their problems, which is the opposite of what we are supposed to do. We don't give advice like life coaches or lawyers do. We help so that an individual finds their own strength to overcome barriers or what their true desires are. Counselor is being used as an umbrella term to provide therapeutic interventions. And unfortunately, here in Canada, in many provinces like British Columbia, Saskatchewan, or Manitoba, counseling therapists are not regulated by a government authority. There are no regulations around the use of the word counselor. People can say they are counselors or therapists even if they have no training in the assessment or treatment of mental health challenges. What does this mean? It means that anyone can call themselves a psychotherapist or a counselor. There are no minimal education, training, supervision, or experience requirements. So as such, it is important to look for someone who is a licensed professional, who has the qualifications to provide therapy. So make sure that the professional you are contacting has at least a master's degree in counseling psychology and is registered with a professional association. When a government authority oversees healthcare professionals to ensure they are competent to perform their jobs safely and ethically, this protects you from incompetent practitioners who may take advantage. Because in some provinces in Canada this is still not happening, you must be sure that the counselor has at least a master's in counseling psychology. I repeat, in my province, in British Columbia, the title you should be looking for is Registered Clinical Counselor, RCC. This designation indicates that psychotherapist has a minimum of a master's degree in counseling. We do not diagnose or prescribe medication, while part of our training involves the knowledge of how diagnosis works. One more time, registered clinical counselors have a minimum of a master's degree. And remember, people can say they are counselors or therapists even if they have no training in the assessment or treatment of mental health challenges. So, it is very important to find someone who is registered with a professional regulatory body. In other words, a professional college or association. This means they have met specific educational and training criteria and are held accountable by professional standards. In British Columbia, clinical counselor is the professional title for mental health practitioners who are registered with the BC Association of Clinical Counseling, BCACC. This registration requires at least 6 years of university education, including a bachelor's and a master's degree, as well as passing grade in comprehensive exams and a rigorous internship. So, in British Columbia, to help you put your mind at ease, when you're looking for a counselor, be sure to look for an RCC, Registered Clinical Counselor designation. Social workers. Registered social workers. Only individuals who are registered with the British Columbia College of Social Workers or who are employed as a social worker by one of the exempt employers under the social worker regulation may call themselves social workers in British Columbia. And only registrants of the college may use the abbreviation RSW. Social work is an incredible broad field. A social worker might provide counseling to people in private practice, but they frequently work in places like schools, hospitals, detention centers, the courts, and many other systems and organizations. They advocate for children and underserved populations, and they help people navigate overwhelming systems. They support a wide range of people across settings. Social workers know what are the resources in the community. In the end, the exact license does not matter. What matters is that it is a mental health professional that has a master's degree or a doctoral degree that follows guidelines and a code of ethics. Number 2, method of therapy. A psychotherapist will choose a theoretical orientation or method of therapy or approach, which is the concepts or perspectives a mental health professional uses to assess, understand, and treat their clients. Any theory that a mental health provider uses to guide their practice is their theoretical orientation. In popular culture and the media, there are a few widely known therapeutic modalities, such as CBT, cognitive behavioral therapy, DBT, dialectic behavioral therapy, EMDR, eye movement, desensitization and reprocessing, and psychoanalysis or psychoanalytic therapy. However, there are actually dozens of modalities that have been developed over the past 130 years, and most of them are less known. I have linked a list of many of those theoretical orientations in the description below. But for those who are not familiar with any, I will give a brief description of the most well-known ones. So let's start with the short-term therapies like cognitive behavioral therapy, CBT, which aims to correct faulty thinking and is directive in nature, where you will be expected to do homework such as journaling, keeping logs, diaries, or doing relaxation exercises. Another short-term therapy is dialectic behavioral therapy, DBT, which also, like CBT, aims to correct faulty thinking, plus how to regulate emotions. So it combines standard cognitive behavioral techniques for emotion regulation and reality testing with concepts of distress tolerance, acceptance, and mindful awareness, largely derived from contemplative, meditative practices like mindfulness. Person-centered or humanistic. This is the approach that most clinicians will be taught in their training. Developed by psychologist Carl Rogers, it seeks to facilitate a client's self-actualizing tendency, an inbuilt inclination toward growth and fulfillment via acceptance, unconditional positive regard. The therapist's congruence, genuineness, and empathic understanding. Existential therapy. It focuses on concepts that are universally applicable to human existence, including death, freedom, responsibility, and the meaning of life. Instead of regarding human experiences such as anxiety, alienation, and depression as implying the presence of mental illness, existential therapy sees these experiences as natural stages in a normal process of human development and maturation. Lastly, psychodynamic and psychoanalysis. Both deal in part with the unconscious mind, the thoughts, feelings, and urges that are outside of our awareness. The unconscious mind consists of ideas and drives that have been subject to the mechanism of repression. Anxiety-producing impulses in childhood are bare from consciousness, but do not cease to exist and exert a constant pressure in the direction of consciousness. However, the content of the unconscious is only knowable to consciousness through its representation in a disguised or distorted form, by ways of dreams and neurotic symptoms, as well as in slips of the tongues and chokes. The psychoanalyst seeks to interpret these conscious manifestations in order to understand the nature of the repressed. This is the main difference between this type of therapy and the others. The notion that people do not wake up in the morning and think, how can I make my life more miserable? Oh, I know, I'm going to do this, that, or think this or that. Reality is most individuals cannot control what makes them suffer because it is coming from an unconscious place. I just gave you a few examples of some schools of thoughts or methods of therapy applied by some therapists, just to give you an idea. But you must be an active participant. This was just the guidance. You must do your homework based on the information I just shared. The more information you have, the better off you will be to select what you want and the type of therapist that is a good fit for you. Once you've decided the theoretical orientation, you can search for an association that your state or your province has for that particular theory. It will help you in providing more information in the names of the therapists that are members of that association. Sometimes it can be a national association. For example, I'm a member of the Canadian Association for Psychodynamic Therapy. Finally, there's a lot of confusion that has been created with the type of therapeutic relationship that is recommended that you must have with a therapist, that you must always like your therapist. Reality is that most important part is that you believe and trust that the therapist knows how to help you. You will have many moments where you will probably even hate your therapist because they remind you of someone or because they point out something that you hate about yourself. This is what is called transference towards your therapist. If you like this video and you found it helpful, hit the like button, which is there somewhere below, and subscribe to my channel. Until next time.